All right, so today we're looking at the muscles for GAP, General Anatomy and Physiology. All right, so we're going on the muscles here of the face. We have the frontalis, which helps to elevate the eyebrows. Orbicularis oris closes the eye. We call it the blink, wink, or squint muscle. We have the orbicularis oris, closes the mouth and purses the lips. We have the zygomaticus, smile muscle. We have the masseter, main muscle of mastication. And on this side of the model, we see the buccinator. All right, so the buccinator compresses the cheek. It helps with chewing, whistling, and sucking. And then over here we have the temporalis muscle. Attaches to the mandible, so it helps with mastication. Now looking at the neck musculature, we have the SCM, sternocleidomastoid, rotates the head, flexes the head. We call it the yes-no muscle. We see the deltoid, anterior, lateral, and posterior deltoid. Okay, so this muscle flexes, abducts, or extends the arm. Pectoralis major. Okay, so pectoralis major attaches to the arm, and so it flexes and adducts the arm. Pectoralis minor is this little one here. We did not look at this on the cadaver, but this little muscle here helps with inspiration. One muscle that we cannot see is the diaphragm, which is inside the abdominal cavity. That also helps with inspiration. Here we see the rectus abdominis, the six-pack muscle, flexes the torso. On the side, we see the external oblique, okay, flexes torso. It also helps with lateral bending and rotation. All right, now switching over to the arm, we can see the biceps brachii, flexes the elbow and supinates. Right here, we see the brachialis, which flexes elbow. Posterior side, we can see the triceps brachii. Okay, all of this is the triceps, extends the elbow and arm. Down here we can see the muscle right here in the middle. This one right here is the extensor digitorum, extends the fingers and the wrist. Now for the muscles in the anterior forearm, I'm going to switch to this model. Okay, so this large arm model, we can see the biceps, okay, and then we can see the muscle out here, the brachioradialis muscle, brachioradialis coming down the lateral forearm, okay, lateral forearm, flexes elbow and supinates. In the anterior portion, what we see here are the three muscles. We have the pronator teres, which pronates, flexor carpi radialis, which flexes the wrist, and the palmaris longus. You can see how it goes right to the palm. Okay, so that is the palmaris longus. That also helps to flex the wrist. Now, one muscle that we can see here, which is great, okay, if we position this a little bit differently, we can see the clavicle and the scapula. This is subscapularis. Okay, so this muscle right here is below the scapula. We call this the subscapularis. Okay, this is the one that adducts and internally rotates the arm. Now looking at the posterior side of the torso, we can see the trapezius coming down. All right, extends the head. It also elevates or shrugs the shoulders. We have the latissimus dorsi. Okay, this one attaches to the arm, and so it adducts and extends the arm. Over here, we can see this muscle. It's a deep muscle. It starts at the sacrum, goes up the spine, goes all the way up the spine. Okay, so this one here, going all the way up, is the erector spinae, extends the torso. It's also a major posture muscle. Here in the shoulder, we see the rhomboid major, minor. Major's on the bottom, minor's always on top. They both retract the scapula. Now here we can see other muscles. I'm going to take the deltoid off. We can see the supraspinatus, abducts the arm. Just below the spine, we see the infraspinatus. Okay, so infraspinatus. Okay, this one also helps to externally rotate and extend the arm. Down here, we can see the teres major, teres minor. Minor on top, major on the bottom. The major runs right along the bottom edge of the scapula. Okay, teres minor externally rotates and extends the arm. Major adducts and internally rotates the arm. Okay, now if you remember what we talked about in lab, supraspinatus, infraspinatus, teres minor, and subscapularis are part of your rotator cuff because they all attach here at the greater tubercle of the humerus. Okay, so the subscapularis wraps around and attaches right there as well in the front. All right, so those are the posterior musculature. We're going to go through the leg. I'm going to do that on the large leg model here. All right, so here's our large leg model. We're missing a little muscle, and that would be this little muscle right in here. So let's look at that little muscle on the torso. All right, so on the torso model, we have this little muscle right here. Starts at your ASIS and goes down to your ITB. This leg here is called your TFL, your tensor fascia lata. So it flexes the hip and abducts the hip. Here we can see the iliopsoas. Okay, originates here around the ilium and attaching here at the L4, L5 vertebrae. It comes down and it attaches at the neck of the femur. So this iliopsoas, all right, this little triangle right here is the iliopsoas muscle that you can see in the front. Okay, that's the most powerful hip flexor. Now we have the longest muscle of the body, goes from your ASIS all the way down to the tibia. There's your sartorius that crosses the legs. Now here we can see the quads. We have the rectus femoris, vastus lateralis right here, vastus medialis, and under the rectus femoris we have this area right in here known as the vastus intermedius. Those muscles extend the knee. Now the rectus femoris also has the opportunity to flex the hip as it attaches up here onto the ilium. Now the most medial muscle in the thigh, most medial muscle in the thigh is the gracilis. Okay, this is the adductor, so it adducts the thighs. On the posterior side of the hip and thigh, we see the gluteus maximus, most powerful hip extensor, and along the superior lateral edge of the ilium, we see the gluteus medius. Okay, gluteus medius. Again, hip extensor, hip abductor. Now we can see the hamstrings. Now the hamstrings, we have three. Again, always go lateral to medial. Okay, biceps femoris, and then we have the semitendinosus, and then on the very inside here we see the semimembranosus. These are much easier to see on the cadaver, especially that really long tendon. But again, it's the same as true. We have biceps femoris, semitendinosus, semimembranosus. These three hamstrings extend the hip and flex the knee. Extend hip, flex knee. Now on the lower leg, the calf, we can see this two-part muscle, two heads to it, making up the Achilles tendon, gastrocnemius. We also see underneath it, okay, so underneath it here we see the soleus, also making up the Achilles. These are plantar flexors. And then the last muscle that you're responsible for in the lower leg is this one right here next to your tibia. There is your tibialis anterior. And that muscle dorsiflexes the foot. And that's all of the muscles that we see in the body that you're responsible for.